and to the gallbladder. And then these 4 front teeth, top and bottom, are connected to the urinary tract, to the anal canal, to the adrenals, to the pituitary, to your kidney, everything that's related to that urinary tract. I use a piece of equipment that was originally called EAV, electroacupuncture according to Vol. I put electricity into the body, and then you gather data from that. So when I'm testing teeth, I actually have the person holding a bar in their hand, and that bar is the collection point, and they touch a tooth and put it in the circuitry, and then I introduce, by touching on a particular acupuncture point, I introduce the electricity into the body to see if it can go all the way through that meridian. And you start seeing where electricity is being blocked, and now you start asking questions about the person's health, and they go, wow, how did you know that? I didn't even tell you that I was having problems there. Because when the electricity can't get through, it compromises that meridian.
Many people have trouble getting their mind around the fact that their teeth are making them sick. But let me just tell you that a year or so ago, we looked at the last 60 cancer patients that we had seen, and 96% of them had an infected tooth in the same power supply circuit as their primary cancer, 96%.
A whole person's jawbone. And it's interesting how, as treatment goes on with the gas, they feel that area where it's going off into is shrinking.
This jawbone area has a very dense nerve network. These nerves don't relay. You know, it's not like here goes to the spinal cord or somewhere else. These nerves go right into the middle of the brain where the regulation of the nervous system occurs. They're called cranial nerves. This cranial nerve is the biggest one in the body, and it goes right into there. And this is a very delicate and protected area. So that if someone has a chronic smoldering infection with biotoxin in this area, it can affect their brain, the regulation of their brain, their energy, and lots of other things.
For example, we had a woman with so-called Hashimoto's disease, an autoimmune problem, and it was coming from a cytomegalovirus from a third molar extraction site in the jawbone, plus nickel ions from an orthodontic retaining wire. Once those 2 substances were removed from the thyroid and the sources, the Hashimoto's totally disappeared. So autoimmune problems are there for a reason. The body doesn't attack itself for no reason. There's something there that's causing that reaction.
So the doctor has to be alert to this, because if he wants cures, especially with cancer, you've got to address these. They're big stressors on the body, and they take a lot of immune attention. And if the immune system's like, don't let the toxin get into the brain and kill me, it's letting the cancer cells go here, or men in the prostate, or in the colon, you know, the big ones, or in the lung. These are the 4 big cancers.
Your chance for cancer is significantly increased. And it's just spreading out of the ignorance of the so-called specialists that they don't want to accept this fact, even though it's absolutely clearly proven.
So in doing the testing of the bacteria, we found that there are, in root canals, 53 different bacteria. 28 of them are directly involved with the health of the heart, that they are known from the scientific literature to create certain heart conditions. Some of them specialize in attacking the heart valve. Many of them cause what's called endocarditis, inflammation of the vessels inside the heart.
And we now have studies from the Journal of the American Dental Association that show that when you have 1 or more root canals in your mouth, statistically speaking, you have a greater chance of heart attack, plain and simple.
We know with increasing evidence that the cause of coronary artery disease is inflammation of the endothelium, the lining of the blood vessel wall. What we need to do in medicine then is work out what is inflaming the wall of the artery, because ultimately what the body does is the body tries to seal off the inflammation. The body uses cholesterol, it uses calcium to seal off that inflammation. You're getting what's called a plaque, the same plaques that we get on our teeth, which is basically bacteria covered by a biofilm, then covered by a layer of calcium, is exactly what we're seeing in coronary arteries. So the trick is not to try and get rid of that cholesterol, which is going there, is being put there by the body to protect us against the inflammation. The trick is to try and work out what is causing the underlying inflammation. Dental infection is a big part of that because of the seeding of bacteria.